it turns out that we're going to have to really fight to preserve what we got, and we got to think about how we're going to strengthen it. So this report is the owl's eye view of the Affordable Care Act. That is, it doesn't cover all 2,000 pages of the Health Care Act, and it doesn't cover all the provisions. It's the owl's eye view, and this report was assembled, researched, written, reviewed by our own OWL experts, and then reviewed by other outside experts. And you've got all the gory details in here, beautifully presented, and I think it's a wonderful report. What I want to really focus on is our recommendations, because you kind of know what the basic provisions are. But we think that, while obviously this is a wonderful step forward, but it could be better. And I think that as advocates, because we're all here because we're advocates, educators and advocates, we need to be alert to what things we need to be working on next. One of the things we want really is important to adopt an essential health benefits package that's comprehensive. And that means it includes home, community, and institutional services. And it has to be affordable and subject to periodic reviews to reflect changes in healthcare needs, medical research, and practices. And because whatever that essential health benefits package is, everybody follows it. So the private insurance will follow. So that's why it's so crucial. I think we need to amend the ACA to establish a national public health insurance option, such as expanding Medicare. And as you probably know, our preferred option for everybody is Medicare for all. But if you're talking about options available, then that ought to be one option that should be available. I think we should support state options to implement innovative approaches to health insurance coverage, including single-payer approaches. Move up the eligible date for innovation waivers from the Secretary of Health and Human Services. Right now it's scheduled to start 2017, but if it starts in 2014, then that gives states an opportunity to really rev up and try to figure out what innovative approaches that they might use. We think it's very important to eliminate the age ratings in insurance premiums. OWL took a leadership stance in this discussion, this latest discussion. The insurance, the age rating was at that point allowed up to like a 5-to-1 ratio, which means that older people, 50-year-olds, could be charged 5 times as much as a 20-year-old for the same insurance coverage. Well, that obviously is a disincentive for any employer to hire older workers if they're going to pay the benefits. So we got it down to that the provision now is 3-to-1, but actually we think it should be 1-to-1. It should be the same. There should be no age rating. We think we should allow the Secretary of Health and Human Services to negotiate with pharmaceutical companies for lower drug prices under Medicare. And as we know, drug prices are one of the things that drive seniors into bankruptcy or into hunger, malnutrition. They give up other things. Or they give up the health care that might come if they had adequate drug use and appropriate drug use. We'd like to have them initiate coverage for dental care and expand the coverage for vision, hearing, and podiatry services under Medicare. I assume you all know that those are not covered. So my hearing aids, which I forgot to wear, and my podiatry treatments are not covered. Dental treatments are not covered. So we really need those because those are a very crucial part of overall health care. We need to make permanent the protection from spousal impoverishment under Medicaid for home and community-based services, and instead of having it come and go. We've got to address the doc fix, And most of you are probably aware of that Congress goes through these little debates about how much we're going to compensate the physicians for providing Medicare services, and docs never know, and they make adjustments, and there's no reason for that. I mean, we really should insist that physicians providing Medicare services and Medicaid services be compensated fairly and appropriately, and that they can count on that, because otherwise we're going to drive them out of the Medicare business, and which is already happening to some extent. So you have to have some kind of common sense formula. I think we need to provide additional funds for the early retiree health benefit, which is a wonderful idea. I mean, that definitely affects women a lot. If you retire a little early, you're not ready for Medicare, but you don't have access to health care insurance. So they figured out a way of funding this, but they allocated $5 billion, and they think that'll probably be depleted by 2014, which is not, that's in the foreseeable future. So we're going to have to rethink that one. And we need to provide additional funding to assist states who are experiencing budget shortfalls with implementation of the ACA. Because a lot of these things are handed back to the states saying, you do it, because states' rights, you do the right thing. And some of the states will, and some of them are going to say, I can't possibly afford that. So I think we need to figure out ways of supporting the states in doing that. And particularly with Medicaid, because half of the expansion in healthcare coverage, which we want, is going to come through Medicaid. And that has traditionally been partly a state-funded program, and many of the states are saying, I can't do that. So we got to figure out some way of making that possible. And the Class Act, which is a wonderful idea, I'm just really thrilled to see it. But I think we need to provide some taxes or other incentives for employers to provide benefits under the Class Act, as well as those who subsidize the premiums for their employees. And Class Act requires it will only work if young people buy in. And so we've got to figure out really some incentives to get young people to sign up for Class Act, which is a way of insuring yourself against long-term care needs. And it's of distributing the risk. And it's a genuine insurance program. And I think it's a great idea. It was one of Kennedy's great ideas. And I hope that we can really make it work. And the Elder Justice Act is a fine addition to the ACA, but it needs to be funded. There's a number of things that look kind of like unfunded mandates, unfunded good ideas, and so we really need to fully fund them because we know that the demand for those services are expanding quite dramatically. So those are our recommendations, and we will ask at the end, I think, for our co-sponsors for your recommendations, see if there's anything that you'd like to add to it. But right now I want to have one of our experts share her perspectives on the ACA. And this is Kathy Greenlee. I'm just delighted to welcome you. She's the Assistant Secretary for Aging, and she was appointed by President Obama, and in January 2011, she was designated as the administrator of the CLASS support program. That's the Community Living Assistance Supports and Services Program, a component of the Affordable Care Act. And she's committed to building the capacity of the National Aging Network, and that is certainly shows in the legislation. So I'm really delighted to welcome you.
Thank you.